In last lecture, we have seen the relations of the internal jugular vein. Vein is draining blood from the cranial cavity, brain, the superficial part of face and the neck. Now we will see the tributaries of the internal jugular vein. The first and last tributaries are very peculiar. The first tributary of the internal jugular vein is a dural venous sinus and last is a lymphatic channel. So here we will see the tributaries of the internal jugular vein. Here we have seen the posterior, anterolateral and medial relations of the internal jugular vein. Now we will see the tributaries of the vein. Again, the tympanic cavity. It is in the floor of the tympanic cavity. So this is the sigmoid dural venous sinus. Superior bulb of the internal jugular vein. These are tributaries of the internal jugular vein. This is the external jugular vein communicating the internal jugular vein through the oblique jugular vein. The formation of the superior vena cava here. So these are the venous channels which are draining in the internal jugular vein. The vein is this is the initial part of the vein, and vein is formed by continuation of the sigmoid dural venous sinus, and at the commencement of the vein it is a dilated part, and this part is known as the superior jugular bulb or superior bulb of the jugular vein. So the first tributary is the inferior petrosal sinus. Sometimes the first tributary may be cochlear vein, which is coming from the cochlea, or it may be inferior petrosal dural venous sinus, and sigmoid sinus is here. This channel is the pharyngeal vein. And it's coming from the pharyngeal venous plexus on the wall of the pharynx. common facial vein. It is formed by union of the deep facial vein and the angular vein. A triangular space formed by the jugular, internal jugular vein, the common facial vein, and posterior belly of digastric. A triangular gap occupied by the jugulo, digastric lymph nodes, the lingual vein. The vein is having superficial and deep components. Superficial lingual vein is accompanying the hypoglossal nerve, and the deep lingual vein accompanying the lingual artery. The deep one is accompanying the lingual artery, and superficial is accompanying the hypoglossal nerve. The superior thyroid vein, confluence of veins coming from the face, the pharynx, thyroid, at the level of greater cornu or greater horn of the hyoid bone. So this is the superior thyroid vein. Clinically important middle thyroid vein coming from the middle of the lobe of the thyroid gland, and this vein is first encountered. This is the first vessel which is encountered during surgery on the thyroid, so it should be prevented and operations should be done very carefully to prevent the middle thyroid vein. The lymphatic channel is at the junction of the subclavian vein and the internal jugular vein, where these two are forming the brachiocephalic or innominate bone. On the right side, it is the right lymphatic trunk. On the left side, it is the trunk of the lymph. The occipital vein may drain in internal jugular, or it may be a tributary of internal jugular vein, but not present always. So these are tributaries: the pharyngeal, common facial, the lingual, that is having the deep and superficial, superior thyroid, middle thyroid, and the right lymphatic channel on right side, and occipital vein. The communications through the cavernous sinus, through the inferior pectoral sinus, and through the external carotid, external jugular vein, through the oblique jugular vein. So these are the tributaries of the internal jugular vein.